Mr. Chair, this is the second of five, only five, and I think there should be more amendments regarding gender-affirming care, trannies, you name it. Castration is not a mistake, by the way. My colleagues on the other side of the aisle want to say that castration is health care, and there's nothing more dehumanizing than going after the trannies out there. One recently shot two young school children in Minnesota. It is a mental illness, and it needs to stop, and we can stop it in our military right now. So this amendment, in last year's NDAA, we took the important step of banning TRICARE from covering medical interventions to treat gender dysphoria, which would result in the sterilization of children. This was a strong statement by the Congress in opposition to the mutilation of kids. However, the language allows the Department of War to continue to perform an array of gender-affirming child abuse on military dependents and to continue to mutilate our service members. My amendment is simple. It would prohibit TRICARE across the board from covering or furnishing the chemical and surgical mutilation of our warfighters and their dependents under the guise of health care. Our government should not be in the business of mutilating our fellow citizens, particularly our warfighters, with our tax dollars, with your tax dollars. This does not serve to advance our national security. It serves only to advance a dangerous and radical ideology that the American people have soundly rejected. Not only have the American people rejected the chemical and surgical mutilation of their fellow citizens, but much of the science doesn't support it as well. The science shows playing into the delusions of these individuals is not compassionate, it's cruel. Numerous studies have shown not only do these cross-sex hormones dramatically increase the risks of infertility and sexual dysfunction, they actually increase in depression, anxiety, and suicidal ideation among those who these medical procedures are performed. The purpose of our military is to fight and to win wars. It is to create war fighters, killers, not to participate in the latest progressive fad. Under the Biden administration, we diverted money away from readiness and lethality to promote extreme gender ideology and fund sex changes in our military. Under the Trump administration, we have finally recognized gender dysphoria for what it is, a mental illness which precludes military service. Our armed services are not a laboratory to study the effects of irreversible surgeries or hormones. Our service does not exist to provide experimental treatments to those whose conditions should be disqualifying. These people are mentally ill and should not be serving in the United States military. This amendment says clearly the purpose of our military is to defend the United States, not validate identity politics. It makes sure TRICARE serves the mission of protecting health, not undermining it. And I urge my colleagues to support this amendment, and I yield back, or reserve the balance of my time.
Gentlelady reserves. Will person the gentleman from Washington State seek recognition?
Claim the time in opposition.
The gentleman is recognized.
Thank you. I yield myself 1 minute.
The gentleman is recognized for 1 minute.
First of all, I want to thank the maker of this amendment for making it clear what the problem is: trannies, mentally ill, insulting transgender people. This is exactly what these amendments are about. It's about a right-wing culture war to try to target the transgender community and make them something less than human. And if you listen to those comments, you get a feel for why that's a problem. Number two, this amendment doesn't have anything to do with transgender people serving in the military. Now, President Trump has already implemented that bigoted discriminatory policy to drive them out of the military. This is about health care for children experiencing gender dysphoria. And what this amendment does is it bans that health care treatment for children experiencing gender dysphoria. I've made a series of arguments in the other amendment about why that is such a bad idea. But the bottom line is this is a legitimate problem. And the studies have often shown that this is beneficial treatment that is now being denied by the United States Congress. This is something that doctors and patients should decide. You know, if we wanted to offer an amendment saying, please look at this issue, here's some studies on one side or the other, ask the medical community to reach their conclusions, that's one thing. But banning it doesn't make sense. I reserve the balance of my time.
Gentleman reserves. Gentlelady from South Carolina.
Mr. Chair, how much time is remaining?
2 minutes remaining.
Okay, thank you. If not wanting to castrate kids is right-wing culture war, sign me up, because this is not the kind of thing that should be happening to children or military dependents anywhere in our country. And castrating kids, it's not health care either. We're talking about something very permanent. We don't allow our kids to be tattooed until they're adults. We don't allow them to drink or smoke or vote until they're adults. But you're saying that it's okay to castrate a kid because of this weirdo freak ideology. Yes, these are weirdos, these are freaks, these are people who are mentally deranged, mentally ill, and this should not be funded by American taxpayers. Thank you, and I yield the balance of my time.
Gentlelady yields the balance of her time. Gentleman from Washington State is recognized.
Current law bans sterilization. So that's just a lot of crap about what this is about. Current law bans what she's talking about. What is being banned here is any treatment for gender dysphoria, and that is completely wrong. With that, I yield 2 minutes to the gentlewoman from California, Ms. Jacobs.
The gentlelady from California is recognized for 2 minutes.
Thank you, Mr. Ranking Member. So as you all know, President Trump has already kicked out transgender troops from the military, despite the fact that they are willing and able to serve, and despite the fact that it will cost billions of dollars and decades to recruit and train their replacements. So this proposed ban on medical care is unnecessary and redundant for our service members because we know the goal here isn't actually about policy. It's a symbolic punishment. It's to send a false political message that trans healthcare is illegitimate, even though those of us who live in reality know that trans healthcare is safe, effective, and medically necessary. It is supported by every major medical association in the US, representing more than 1.3 million US doctors. And let's be clear by what we mean about gender-affirming care. We don't only mean surgery. Sometimes it's just using the correct pronouns. Sometimes it's mental health care, sometimes it's hormone therapy, and yes, sometimes it's surgery. This ban would also take away mental health care from the trans children of our service members. We know that trans youth face significant mental health challenges, not because they're trans, to be clear, but because of the external factors they face like social isolation, discrimination, lack of affirmation, the stress of not getting the care they need, having to hear colleagues of mine say horrible things about them on the House floor. And like any parent, if a service member's child can't get the care they need, they will be distracted from their mission. So ultimately, this ban will hurt our military readiness and likely lead service members to leave the military. This amendment isn't only bigoted, it's short-sighted and would hurt our national security. So I urge my colleagues to oppose this amendment, and I yield back.
Gentlelady yields back. She already yielded back. That's all right.
May I inquire as to how much time I have remaining?
2.25 minutes remaining.
Thank you. At this time, I'm pleased to yield 2 minutes to the gentlewoman from Vermont, Ms. Ballant.
Gentlelady is recognized for 2 minutes.
Thank you, Mr. Speaker. I rise today in strong opposition to this amendment. If passed, this amendment would immediately prohibit TRICARE coverage of mental health counseling for transgender young people. Let me repeat that. This amendment would take away mental health care services for transgender kids of service members. That's what we're talking about. This amendment is intentionally discriminatory and result in higher rates of mental health issues and suicide for trans youth, kids who already experience higher rates of depression and anxiety and suicide compared to their peers. Republicans' all-out assault on health care right now has put these people into a state of constant fear and anxiety. Imagine that you're a service member, you're a parent, and you hear from a doctor that Congress has banned medically necessary care endorsed by every major medical association that would literally help save your child's life. All young people in this country should have access to the mental health care that they need. Full stop. Forcing service members to choose between being able to provide health care for their family, for their kids, or serving their country does not make our military stronger, does not make our country safer, and it will not, no matter what the member says, it will not make transgender people in this country disappear. I urge my colleagues to vote no.
During a debate on the House floor, Representative Nancy Mace, RSC, proposed an amendment to the National Defense Authorization Act, NDAA, that sought to ban service members and their dependents from receiving transgender health care. The amendment was introduced as a response to what the Congresswoman viewed as an unnecessary inclusion of gender-affirming care within military health care services, particularly TRICARE, the military's health insurance system. Mace argued that gender-affirming procedures, including hormone therapies and surgeries, are not valid forms of health care but instead represented a form of mutilation. She emphasized that these procedures could result in irreversible changes, arguing that they could lead to infertility, sexual dysfunction, and mental health issues such as depression, anxiety, and suicidal thoughts. According to her, these treatments did not align with the primary mission of the military, which is to create warfighters capable of defending the nation, not to validate progressive ideologies related to gender identity. Mace's amendment specifically sought to block TRICARE from covering any chemical or surgical interventions related to gender dysphoria for military personnel and their dependents. She expressed her belief that the American taxpayer should not be funding what she termed child abuse or the mutilation of service members and their families. She framed this as a moral and practical stance, arguing that such policies undermined national security and diverted resources away from military readiness and lethality. Opposition to the amendment came quickly, with other members of Congress, including Representative Pramila Jayapal, Democrat Washington, decrying the proposal as bigoted and harmful. They argued that the amendment was part of a larger culture war meant to target the transgender community. Jayapal emphasized that the amendment was not about military service or readiness but about denying health care to children experiencing gender dysphoria. She and other opponents of the amendment noted that gender-affirming care, including mental health services, is vital for transgender youth, many of whom face higher rates of depression, anxiety, and suicidal ideation due to societal discrimination. The debate also revealed sharp divisions over the role of the military in providing health care. Some lawmakers stressed that transgender service members should not be denied the right to serve or receive necessary medical care, especially considering that such health care is endorsed by major medical organizations and has been shown to improve mental health outcomes for transgender individuals. Ultimately, the opposition argued that the proposed ban would do more harm than good, both for military readiness and for the well-being of service members and their families. They warned that denying health care to transgender children could result in further mental health issues and could even lead to more service members leaving the military due to the inability to care for their dependents. The debate underscored the broader political and ideological divide over the rights of transgender individuals, especially in the context of the military and health care.